Cancer has a major impact on society in the United States and across the world. It's estimated that about half of all men and a third of all women in the United States will receive a cancer diagnosis at some time in their lives. According to the National Cancer Institute, in 2016, an estimated 1.6 million new cases of cancer will be diagnosed, and 595,000 people will lose their battle. Receiving a diagnosis can be life-changing and often comes with little warning.
They told me over the phone that they were sorry to inform me that I was actually diagnosed with cancer, breast cancer. And I remember not hearing anything after that. She kept talking and I just couldn't believe it. Huge, overwhelming uncertainty, definitely. I remember telling her that I would have to call her back. I dropped to the floor and just cried.
When I got the diagnosis, my attitude was that, life puts little speed bumps in your road, and you just have to slow down, go over them, and keep on going. I think my family probably had more difficulty dealing with the diagnosis than I did. I just looked at it as something I had to do and didn't have much choice about it, so let's go get it done.
When I was diagnosed with cancer, I was apprehensive about having cancer and a little worried, and my brother had succumbed from it, and my other brother is ill with it now. My mother died from it, and all these thoughts go through your mind like, wow, is it really happening to me?
Surgery, chemotherapy, and radiation are the most common types of cancer treatments. Depending on the diagnosis, patients may need one or all three of these treatment options. For Amy, Ben, James, and many others in our communities facing a cancer diagnosis, Morris Hospital's Cancer Care Program and Radiation Therapy Center is here to help. Our Radiation Therapy Center is accredited by the Commission on Cancer of the American College of Surgeons. This means Morris Hospital has voluntarily committed to providing the highest level of quality cancer care and has undergone a rigorous evaluation process and review of performance. For patients, receiving care at a COC-accredited cancer program ensures access to comprehensive care, state-of-the-art services and equipment, a multi-specialty team approach to coordinate the best treatment options, information about ongoing clinical trials and new treatment options, access to cancer-related information, education, and support, a cancer registry that collects data on the type and stages of cancers and treatment results, and ongoing monitoring and improvement of care.
I think the staff here and the comprehensive program here is university quality. We do studies here, and we treat patients just as we treat it anywhere else in the university setting. So you're getting good quality care, and the staff at Morris Radiation Therapy, I can't say highly enough. All the patients love staff here.
Radiation therapy has two equally important goals: to control the growth of cancerous tumors, and to do so while minimizing exposure to the surrounding normal, healthy tissue. At the Radiation Therapy Center of Morris Hospital, radiation therapy is delivered to the tumor using a linear accelerator. This complex and sophisticated computerized equipment uses high-energy radiation to damage cancer cells and treat tumors in the body. While our current linear accelerator at the Radiation Therapy Center remains fully functional, it has been in place since we first began offering the service 12 years ago. Advances in radiation therapy have been made in the past decade as improvements to imaging modalities, powerful computers, software, and delivery systems have enabled this technology to evolve. In order to take full advantage of technological improvements and advances, a new linear accelerator is slated for purchase later this year. This $1.8 million investment will redefine treatment precision, speed, and control. For our patients, this means faster treatments and ultra-low radiation dose safeguards. Having this advanced tool in our community also means that patients don't have to travel far from home to get this life-saving treatment.
Honestly, without the cancer center here in Morris, I wouldn't have got treatment. I wouldn't have had treatment. I would have just lived my life out.
For men and women in our communities and across the world, patients, families, researchers, physicians, nurses, and everyone in between, living courageously means dedicating their lives to finding new and better ways to prevent, diagnose, and treat cancer. This project is our commitment for better cancer care that is centered on the needs of each and every single patient. We need your support to keep up the fight.
I wouldn't have had the same kind of chance that I was given. And perhaps that's why it's so important that we look to the future in terms of advanced technology and what we need to bring to Morris Hospital, so that someone who may not have that good of a chance today may have an infinitely better chance tomorrow because of something we've been able to provide.
Please consider a gift.
Thank you.
Thank you.
Thank you very much for giving me my life back.